GBV Prevention Approaches in Programming. Gender-based violence, or GBV, is preventable. GBV prevention programming is life-saving. Let's look at the 4 types of prevention approaches. The Interagency Minimum Standards for GBV in Emergencies programming categorizes GBV prevention approaches as follows: risk mitigation, primary prevention, secondary prevention, tertiary prevention. Risk mitigation aims to reduce the risk of exposure to GBV through all aspects of service provision. How? By addressing contributing factors to GBV that might expose women and girls as well as other at-risk groups to increased risk of violence. An example would be integrating features to increase safety based on consultations with women and girls and other at-risk groups. It could include providing more lights in camps, ensuring enough well-marked, sex-segregated, and lockable latrines and bathing facilities, ensuring that shelters have privacy features and are allocated in a way that reduces risks for women and girls in particular. Primary prevention focuses on preventing GBV before it occurs. How? By tackling the root causes of GBV: gender inequality, systemic discrimination, and unequal power relations. This approach requires long-term transformational change to focus on positive norms. The social, economic, and political empowerment of women and girls is integral to the program design, as is addressing impunity for perpetrators of GBV while engaging men and boys in GBV prevention. Structured, evidence-based, tested, and proven long-term programs may be employed. Secondary prevention focuses on response for survivors and consequences for perpetrators. How? By addressing the consequences of the violence, mitigating the harm this violence can cause, and taking steps to prevent the violence from happening again. These include availing healthcare, case management, psychosocial, and legal support services for GBV survivors. Tertiary prevention includes actions that focus on the long-term impact of violence when untreated. How? Through working on community reintegration and acceptance, addressing trauma and the long-term medical and psychosocial needs of survivors. Now that we are familiar with the 4 categories of GBV prevention approaches, it is important to remember that safe, ethical, and effective GBV prevention programming must ensure that essential services for health and psychological support, at minimum, are functional before embarking in transformative social norms and systems change interventions. Staff and volunteers working on prevention programming are aware of how to safely refer GBV survivors who disclose GBV during community outreach activities and wish to access support services. Local systems and norms and how they sustain gender inequality and GBV are understood. A gender and power analysis would help shed light on this. Intersecting forms of oppression, discrimination, and marginalization based on coexisting identities are mapped out. Intersectionality is an important element to understanding gender and power dynamics. Implementation and outcomes are jointly monitored with communities to mitigate risks and address unintended harmful consequences. Accountability to women and girls is critical to safe, ethical, and effective GBV prevention programming. It is key to securing women's and girls' full and equal rights. The meaningful participation of women and girls must be ensured in all stages of programming. Partnering with women-led organizations, particularly those led by asylum seekers, refugees, stateless, internally displaced persons, or returnees, is essential. It is an opportunity to support and sustain localized action in addressing GBV against women and girls in humanitarian action. GBV prevention programming is essential for the protection of women and girls in particular. This remains the primary outcome of prevention programming. Remember, GBV is preventable. GBV prevention programming is life-saving.